Hello everyone, this is Dr. David Suarez from Pure Wellness Medical, where we live pure and live well. I'd like to discuss with you why we do hormone replacement therapy. The current trend in medicine is to treat a disease, never looking for the cause. We remove a symptom with medication, and as we're trying to treat that disease or chronic illness, we're never really looking for the reason that caused that disease. Our model of Pure Wellness Medical is very different. We try to prevent any chronic disease from ever occurring. We improve your health with lifestyle modification and health optimization. We avoid those chronic diseases before they ever develop, and if you do get a disease, we're able to help decrease its effect on your life. Health starts with constant change, as our bodies are trying to find the best balance all the time. As we decrease in our ability to adapt, we lose our health. Hormone imbalance starts in our early to late 20s. We just don't feel the same way that we did. Our energy levels are lower. We have a decrease in stamina and endurance, and we have poor exercise results, no matter how hard we train. On the average, we produce 2 to 4 less hormones per year after the age of 25. So if this goes unchecked for 10 years, you can have a 20 to 40% decrease in your hormone levels. As our hormone levels decrease, we start not to feel as well. Our bodies try to compensate with increasing other hormones as other levels continue to decline. By replacing the hormones to optimized levels, not reference range levels, we start to feel rejuvenated, our ability to adapt is enhanced, and we improve the quality of our lives. Diseases of aging should not be a normal part of aging. Prevention is the most effective solution of any disease process. The most important and successful treatment to help prevent disease and the deterioration that occurs with the disease and aging process is to be accomplished with health optimization. And that is done with hormone optimization and replacement, vitamin supplements when needed, a good exercise program, and healthy nutrition. So what are the different types of hormone therapy that are available? Well, there's synthetic hormones. They have a different chemical structure than our hormones. They have an increased number of metabolites or breakdown products, and they also have an increased number of side effects. Synthetic or chemically altered hormones are similar to our hormones, but they're not exactly the same. They are still different. So they don't work as well, and they do have a higher amount of side effects. One of the other major problems is that you cannot have specialized doses individualized for you. They're mass produced, and you have to take what they have. The next type of hormones I'd like to discuss are natural hormones. These hormones are taken from other animal species, like horses, which is equine, or bovine, which is pig. They may or may not be identical to the human hormones that we naturally produce, but they're usually very close. They do have less side effects than synthetic hormones. The best option is bioidentical hormones. This refers to the molecular structure of the hormone, not the source of the hormone. So it doesn't matter whether it's coming from a plant, whether it's compounded, or whether it's synthetic, or whether it's coming from a natural source. They are identical to the hormones our body naturally produces. This allows for higher doses, less side effects, and all the benefits. There are a lot of various forms for bioidentical hormones. There's capsules, dissolving tablets, sublingual tablets, regular tablets, creams, gels, and even pellets. Every medication can have an individualized dose and concentration that's made specifically for your needs. A lot of medical literature supports less side effects and complications with bioidentical hormones than with their synthetic hormone counterparts. So what are the common myths about hormone replacement therapy? The first one is, I don't want to get too big or too muscle bound. Well, you do get leaner, And you do get a better quality of muscle, but that doesn't mean you're going to get muscle bound. You have to train specifically for that and take high doses. Well, I heard about the personality changes. Again, this is done with higher doses, and it's usually not when it's prescribed by a physician. Well, I heard there's a cancer risk. Well, again, this isn't true either. A lot of studies show that there's actually a decrease in cancer when you're using bioidentical hormones. Well, I heard that they cause heart attacks. Again, this is false. There are more studies that show the benefit of bioidentical hormones and that it actually decreases your cardiovascular risk. There are thousands of research articles today that explain when hormones are optimally replaced, they are not only safe, but they're effective and beneficial for the long-term health of everyone. So why would major drug companies produce drugs or products that are synthetic or that have adverse side effects? Money. Naturally, biologically identical hormones are not patentable by drug companies. They already exist in nature. So if there's no patent, there's no proprietary product, therefore they can't make a profit. So why does the public resist medicine? Well, they resist mainstream medicine and they resist the pharmaceutical industry because of the well-publicized side effects of medications and the huge out-of-pocket costs of medications. Well, why does mainstream medicine resist hormone replacement therapy? Mostly because they're not taught hormone replacement in medical education programs. They're not taught about compounding, they're not taught about the different levels, they're not taught about how to read labs differently, and they're not taught that you can't treat a patient like a textbook. Everybody has individualized symptoms and individualized results to the levels that you're giving them. Bioidentical hormones can be made from a major pharmaceutical industry or from compounding pharmacies. The main thing is the structure of that hormone to be identical to yours. They have a higher bioavailability, which means your body is able to use more of that hormone. There's virtually no side effects when it's prescribed properly and monitored, and the doses can be individualized based on your needs. So what are the common reasons for hormone replacement therapy? Well, there's some common reasons between men and women. Decrease in libido or sex drive, fatigue, sleep problems, night sweats, intimacy issues, mood swings, increase in body fat, decrease in muscle mass, poor exercise results. Women have a higher incidence of osteoporosis, perimenopause, and menopause. So what are the benefits of hormone replacement therapy? Decrease in visceral fat, which is the fat in between our organs. Decrease in peripheral fat, which is the fat that we can see. Improvement of muscle mass. Improvement of muscle strength. A boost in endurance. It raises our sex drive. We have an increase in insulin sensitivity. It helps us combat fatigue. It enhances our immune system. We have a reduction in degenerative diseases like arthritis. It relieves depression and stress. It prevents and slows cognitive decline. Helps thicken our skin and decrease wrinkles. But most importantly, it helps improve the quality of our life. How do we evaluate you for hormone replacement therapy? Well, we do an extensive symptom history. Our goal is to treat the cause, allowing you to decrease the symptoms. Certain symptoms can point to different hormones, but many symptoms are common for different hormones. So we do an extensive blood work panel, which gives us a good baseline and helps us to understand where you are and where we want to go. We want to get you to optimized levels of your hormones, your vitamins, and your minerals, not laboratory reference ranges. Some patients can't tolerate high doses. Some patients desire very high doses. Desired levels can be individualized with hormone replacement therapy. We're able to make a program and protocol specifically designed for you. We're able to adjust your program to maximize your results as needed. So now it's time for you to take the next step. Thank you.